According to guidelines and in order to minimize the exposure time to high viral load, the imaging should be limited to answer the relevant clinical question. For the same reason, ECG recording is not required and it is suggested to store loops and measure later in a safe place. Typically, we need to assess left and right ventricle function and major structural valve disease. To store the loops, and since ECG may not be attached, make sure you switch the store mode from number of cycles to time span and have 3 seconds set. Right now we see on the touch panel that the system is set to store specific number of cycles. In order to switch it, we press the 5th knob on the console. Pressing it is switching the store mode from time span to number of cycles and back. By rotating the same knob, you can change the value. 3 seconds should be enough. The first recording is the parasternal long axis. Here in 2D, when we press the color button, we can examine the flows for any potential regurgitations on the mitral valve and the aortic valve. Then switching back to 2D and pressing the M mode, we're having the M mode. Make sure that the M mode line is perpendicular to the left ventricular walls. Then pressing the measure, the measuring menu appears where we select the LV study option. Starting the measurement from the systole, the end systole, measuring the intraventricular septum in the posterior wall and the internal diameter of the left ventricle. The results of the measurements appear on the left. Moving on, we have the parasternal short axis view at the level of the mitral valve and at the level of the papillary muscles. Moving to the apical window, we're getting the four-chamber view. In order to measure the ejection fraction here, we need to press the measure button in the menu. Go to volume, biplane, and the first measurement here is the end diastolic volume measurement. In order to move to the end diastole, we need first to stop that video from playing. We can do that by pressing the pause button or to defreeze. Right now, we're not sure if we have stopped at the end diastolic moment, so we may need to move left and right through the loop to find the correct frame. You notice on the bottom right we have a map of the trackball and the available functions. The trackball can either control the scroll or the measurement and analysis cursor, where we can go inside the image and start measuring. In order to switch between the two, we can hit the trackball button. Every time that we press it, the function is switching between the available functions of the trackball, either scroll or measurement and analysis. In scroll mode, left and right on the trackball is moving through the frames of the loop. In measurement and analysis, I have my measuring caliper and I can get inside the image and start measuring. If needed, we press the trackball button in order to move into scroll mode, and we move left and right until we reach the desired position and diastole in our case. Pressing trackball again to switch to measurement and analysis, and now we can measure. We can trace the endocardium here, clicking first point, moving the trackball around the endocardium. If something is wrong, you can move backwards and the line is going to be erased until the opposite position. Click once more. The system is drawing the mitral valve level, and you are requested to give the length of the left ventricle. If you agree, you can click once more. And we have the volume of the ventricle in diastole. The system is automatically moving into scroll mode, so we can search now the end systole. Pressing the trackball button again to switch to the measurement and analysis, and coming in to do the second trace. Click, draw, and click again. The length we accept, and we're having the measurement on the upper left. Next, we're moving to the color flow image of the 4-chamber view to examine for any regurgitations, and then the 2-chamber view. In here, we're going to do the same calculation as we did before, the ejection fraction. For that, we press again the measure button. We see that the next calculation is the end diastolic volume calculation. We need to stop the video from playing, so we press the pause or to defreeze button again. And we will need to check what is the current function of the trackball. Here it is measurement and analysis. That means that I can move in to measure, but I'm not in the end diastole, so I need to switch by pressing the trackball button again to scroll. And diastole is here. Switch to measurement and analysis, and now I'm ready to perform the measurement. Click to start the drawing of the trace. Follow the endocardium. Exclude the papillary muscles and finish at the opposite side of the mitral valve ring. Click again. System is asking for the ventricular length. Click to set it, and the end diastolic volume is calculated. The system is automatically moving to the end systolic volume, and it's changing the function of the trackball into scroll, so we can scroll to find the end systole. And systole is here. Pressing trackball button again to switch from scroll to M&A, and start the trace again. Click, and click again for the length. Now on the upper left, we have the 2-chamber calculation, and combined with the 4-chamber calculation from the previous image, we're having also the biplane calculation. After the volume calculations, we can have a look at the color flow on the 2-chamber view again. And then we can move to the 3-chamber view. No ejection fraction calculation here. We can examine, though, the flows through the aortic valve and to the mitral valve with color. To assess the right ventricle function, we can use the 4-chamber view loop. It is possible to activate the M mode in post-process. When we press it, we are entering the anatomical M mode function. And we can perform an M mode anywhere on that loop. Right now, you notice the trackball function on the bottom right is angle/positioning. I can move left and right and perform M mode in different positions. We move the M mode line towards the free wall, the base of the free wall of the right ventricle. Over there, we press the measure button, and in the measurements dimension and TAPSE. The TAPSE measurement is measured from the lowest point of the tricuspid valve ring to the highest. To assess the pulmonary hypertension, we need a continuous wave Doppler through the tricuspid regurgitation jet. Then we can measure that peak velocity and pressure. Measure button from the menu, tricuspid valve, and tricuspid regurgitation velocity maximum. The anatomical M mode is also very useful if the parasternal long axis view that we get cannot have left ventricle walls perpendicular to the M mode line. So again here, we can go into the M mode by pressing the M mode button. And we see that again, we can move with the trackball left and right, the M mode line. What we can also do is if we click the set button, then the function of the trackball is changing into the angle. You can notice on the bottom right how it is changing between angle and positioning. When in angle mode, the green line, which is the active M mode line, can rotate and give me the M mode in any plane. So this way, I can rotate the M mode line in order to have a good perpendicular position without losing too much time in the scanning phase.